Hi everyone, my name is Justin. I'm a fitness instructor at CFB Kingston with PSB. Today I'm going to be talking a little bit about lower limb injuries and how to return to our training and our daily activities in our sports after suffering from one. So it's very unlikely that anybody watching this video has ever suffered an injury before in their life. Some may be more minor than others, some may be require a little bit more work on them, but everybody's probably gone through some form of injury, whether that's their sports, whether that's through their work, or just little accidents that happen. So it's something that everybody has to deal with. It's really a universal thing that we're going to be talking about today. As we go along, I'm going to specify a little bit further. We're going to specifically talk about the lower limb. So that's kind of including stuff for your hips, your legs, your knees, your ankles, that sort of thing. Basically, a lot of things that do tend to happen within the military environment a lot, and I have seen affect people and put people on the chits, unable to participate in ruck marches, unit runs, that sort of thing. So that's kind of what we're going to be tackling today. Injuries can affect people in a lot of different ways. Two main big ones that does tend to take its toll on people, especially when it's a little bit more of a severe injury and they're out from things out of commission for a little bit, tends to be a little bit harder on people. People will react differently, just depending on the person. But even when people say that, like, it's like, oh, it's fine, they kind of just fight through it, that sort of thing, it doesn't mean that it still doesn't affect them in some way or another. The signs that are kind of more fairly obvious is your physical limitations when you're injured. What ends up happening is being injured, especially the lower limb injury means you may have difficulty even just kind of getting around the office, participating in unit marches, going for runs. Doing PT becomes fairly restricted when you do have a lower limb injury. And especially if you have a little bit more of a physical job, it makes it quite a bit harder to participate in all those full duties. It also makes it a little bit harder when you're trying to participate in those full duties to actually recover from your injury. So you get that sort of little bit of, you get put off from doing work, participating in PT for a little bit. It's kind of one of the major physical aspects of being injured, particularly with the lower body. The other major aspect does tend to be that generally it sucks, it's painful. Being injured is very uncomfortable. You might have to sleep in different positions, you might have to kind of adjust just how you do things. It just makes everything generally a little bit harder. Particularly for the military population, having a lower limb injury often means that you may not be able to participate in the force test, which can have a bit of a detriment to your job position or different things that you may want to apply for. This kind of goes the same for if anybody wants to go into selection testing. What happens is you have to also account for kind of recovery time from injury and then retraining yourself post-injury to be prepared for that. So it takes quite a toll on your training, especially when there's specific things that you kind of prepare yourself for throughout the year. Another big thing is, I know within the military, a lot of people do enjoy playing sports. This tends to be an outlet for people to spend some energy, get some exercise for themselves, or just something fun to participate, either with their units or with their friends. This kind of leads us into the mental aspects of injury. When you feel that you can't really participate in things, if it's something that you did for fun, like 2 times a week, you miss out on that. At work, when you have to change your duties, like, people will get into this sense of like feeling like they're not contributing, or like that feeling useless sort of sense. That's not really a fun thing to feel at all. And being injured and not being able to do something about it immediately becomes very hard on somebody. The first type of lower limb injury I'd like to talk about is your ligament sprains. So most common one, this tends to be when somebody rolls their ankle out for a run, step off the sidewalk, grass is a little uneven, that sort of thing, going over on your ankle, you feel a little sharp pain, sometimes you get like a little bit of a pop. That's going to be where you're getting your ligament tears, what will be considered a sprain injury. With these, they could be very minor and just take about 2 weeks to heal or so, but that's going to be 2 weeks of being careful with it, doing a bit of active recovery. That's kind of your best prospects. Some of these though can be quite severe, especially when you get into full tears of the ligaments. Can even sometimes require surgery. Even if it doesn't necessarily require surgery, some of them can take up to 2 months to heal as well. Even if it's kind of in a small area. So if you think about in your ankle, a lot of small ligaments in there, kind of keeping everything nice and stable, keeping everything compacted. Basically, what happens when you sprain that, it's kind of hard on you because it means that it's going to be affected every time you take a step when you move around and about. So kind of a wide range of how long it takes for recovery time, just in the fact of that's like how it is that you move about during the day. So just to kind of recap that again, kind of minimum 2 weeks healing time for a sprain, whether that's kind of ankle, knee, that sort of thing. But some of them that are more severe. So like when you get into, there's a lot of like ACL tears in your knee. A lot of those will require surgery and can take much longer to heal. Big thing to remember with ligament sprains is once these are kind of damaged one time, there is a greater likelihood of it being re-injured in the future. So if you kind of sprain your ankle a bunch of times as a kid, very likely that as an adult, you have a greater chance of re-injuring in that kind of same manner, or the ligaments around in the same area. That being said, it doesn't mean that there's not anything you can do about it. There are different things that you can work on to help prevent that re-injury in the future. So muscle strains are the next type of injury I'm going to talk about. This is your typical, like, I think I pulled my hamstring sort of injury, when basically muscles are affected. This can be much more minor in the sense of, say, strain something in your upper leg, it's a little bit of a pull, you might have ran a little too hard one day. About 3 weeks to kind of recover from that. Fairly good prospects of recovery with that, but you can have much more serious ones where you get full tear of a muscle. So people have probably seen things where they potentially have had friends it's happened to, where muscle tears, you can see it kind of like bunched up. So a lot of common ones people have seen on the upper body, but you can get stuff like down in the lower body with your calves, kind of those full muscle tears. Real bad news, typically require some form of surgery with that, and a much more extended recovery time, like several months is what we would be talking about there. So broken bones is the last kind of major injury type that I'm going to talk about with you today. These are the ones that tend to be a little bit more dramatic looking, especially in cases when it's quite serious, if the bone breaks the skin, that sort of thing. We'll talk about it in a second, but there are like fairly good prospects like after you break a bone, if well taken care of, can have like fairly good recovery with it. Broken bone, minimum 6 to 8 weeks, so about that 2 month mark is what we're going to take to heal. So that 2 months of healing time, during that time, very important that the broken area is protected, not just to allow for healing of the bone itself, but also to make sure that the tissues around it are protected. There are some things that you have to look out for, like in more serious cases. Think kind of like in your leg, you have your femoral artery in there. If someone was to say break their femur, which takes quite a lot of force, but it has happened. In that case, you have to be careful about the bone cutting through artery, that sort of thing, because that would cause like, excess bleeding. And so there's a few more kind of more dangerous aspects that we have to look at with broken bones. But if well cared for, there's a good chance of recovery with these. I have worked in clinics for quite some time, quite some years, and a number of times I have patients come in and they just have like a small muscle strain or like a little ligament tear or something. They're saying it's taking so long for it to heal. And the big thing everybody will say to me is that it's like, oh, it's not like I broke a bone. Like, why is it taking so long? That's because with bones, usually people will kind of treat it a little bit more seriously. A lot of time they get a cast, the bone is immobilized, so it's well protected. Whereas something with like a small sprain, so like you sprain your ankle, you limp a little for a little bit, and then just kind of shrug it off and be like, oh, it's fine. Whereas, say, if you broke your ankle, you'd be in a boot, and it would keep you a little bit more protected, a little bit more. It's given a bit more chance to heal. That being said, after healing, because muscles around that broken bone may not have been used as frequently as they used to, essentially post-break training period after healing time for the bones is going to be very, very important. So with broken bones, one thing we do have to be also very aware of that it's not just big traumatic breaks like breaking your leg, snapping bones. Those we're all kind of quite aware of. We do have to be very careful of more kind of insidious fractures. So these are like our stress fractures. These tend to happen a lot in endurance athletes. So folks who are running a lot, running very frequently, long distances. It does take a toll on its body, and your muscles and ligaments work hard to protect the bones. But sometimes after enough kind of impact to it, you can start to get these small little microfractures in the bones, and not necessarily always noticeable at first, but it does kind of gradually build up. These types of fractures are quite hard to heal from, just because of the amount of time it's actually gone into causing the injury. It takes at least a little time to kind of recover from it, and it's something that we have to be aware of, and also make sure that we're not kind of too hard on our bodies when we do start to have sort of some suspicious pains, especially if you're a long distance runner and you're running quite frequently and you're starting to have repeating pains every time you go for a run. Good time to kind of take a little bit of a step back and kind of check that out, make sure that you're not progressing yourself down the road. That's going to be a long recovery from and put you out of commission. Better to take a little bit of a step back for a short time than push yourself right to being out of commission for an extended period. So a real bad thing for your injury recovery and just for your body in general is being immobilized for too long. So I'm going to start to delve a bit more specifically into lower body today, and that's kind of where we're going to chat about other examples for the next little bit here. Say if you sprain your ankle, and say that it's real bad and you actually have to put a brace on for a little bit. So you've stopped running, you've stopped doing PT. Basically, if that's kind of stopped for too long, you kind of reach a point where your injury is just going to get worse by keeping it more immobilized for too long. Injuries benefit very much so from active recovery, so doing small movements, basically kind of what you can with minimal pain. There'll always be discomfort when you try to start moving again with injuries, but it is important to not avoid things forever. That's kind of the idea. I do hear a lot from people that will say, I don't squat, I don't deadlift because of my knees. Not kind of the way that we want to go. Basically, most everybody has to do some form of squat or deadlifting pattern, even if it's just something as simple as picking something up off the floor. That's your hinge pattern, which comes from your deadlift. Even just like something as simple as sitting down in a chair at your office, sitting down on the toilet, that is going to be your squat pattern, lowering down towards the ground. So avoiding those types of movements is not really going to be good for you in the long run. Doesn't mean that everybody has to go back and squat and deadlift heavy, but everybody should have kind of basic foundation of those main patterns. That being said, there will be some injuries, like broken bones, for example, when you have to be in cast and you must be immobilized. In that case, you obviously shouldn't be getting back to some of the major patterns that you did before, or that you should be doing. In that case, there is also that healing time that's required, but then after that period is over, you're able to start actually doing movements when it's very imperative to get back working on those main patterns. Big thing with working on kind of your main patterns. So when we're talking about the lower body, it's your gait, so just kind of how you're walking, your squatting, your hinge patterns, coming up on your toes, that sort of thing. Very important to work on those as soon as you're able to, pain-free. Like I kind of mentioned before, it's okay to have a bit of discomfort, but you shouldn't be having sharp pains when you're going through your movements. Essentially, if you are still having some real bad sharp pains, might not be fully healed yet, you're just not quite ready, just need a little bit more time, and that's okay. But once you're able to start working on patterns relatively pain-free, this is dramatically going to help with your recovery, because moving the muscles in the direction that they are meant to kind of helps them with their healing process, helps get all those tissues healed back in the proper form where they should be. It helps with your ligaments starting to kind of tighten up again and keep you stabilized when you're going through those kind of major movements. Even simple things like walking, real great for your recovery. Going along with that, it is very important to gradually go back into training activities and that sort of thing, even just some of the stuff you do daily. If you're not quite at the point that you can comfortably move into a squat position, it's definitely not time to start moving into going for runs or jumping or any sort of like high impact dynamic movements. That kind of goes both for people who are injured and for people who I kind of talked about earlier, if you've kind of been avoiding those movements for a while. Very important to kind of have your basic functional movements down before you start getting into some of the stuff that's this high impact stuff that's going to be a bit harder on your body. So speaking directly to the military population, there is an emphasis on PT and as well as things like unit runs and unit marches and doing stuff kind of as a unit to both kind of build morale, camaraderie, as well as state force rating, that sort of thing. But as a military member, do have to kind of be aware for yourself when it's kind of a good time to go back to those things. So if you injure yourself and you go on chip, don't try to throw yourself back into things too early. So I'm not saying avoid things. Basically what you want to do is, especially when it comes to like kind of more mild injuries like an ankle sprain or a moderate ankle sprain, might not be able to go for a run, but you could work on some of your light squat patterning that day. You could go for an easy walk if it was relatively pain-free. Could even go for kind of less impact activities, so something like cycling, swimming. It's very important to kind of be aware, for everybody to be aware that somebody does have an injury, and that may kind of put you off from doing some things for a short period, but it will be a much shorter period if you kind of take the time upon yourself to really focus on that active recovery, just as we kind of mentioned earlier. It just tends to apply within the military setting quite a bit more, just because I know everybody does go through quite a lot of high impact activities, whether that's through PT, force testing, or just through unit activities and tasks. So two main points, particularly for the military setting, is just remember to, when you do get injured, focus on active recovery and making your way back to kind of your regular duties, your regular PT sessions in time, but give yourself that rest time as needed, and then as soon as you can, get back into active recovery and working your way back up to kind of your full regular tasks and PT. The second point I want to talk to on that is a lot of people have a competitive nature and want to get back with their unit, get back to running, that sort of thing. A lot of time it will come from people's pressure on themselves. This goes back to what we talked about earlier, kind of the mental effects of injury. You feel like you're kind of letting the team down, letting your unit down, or you feel like you're missing out on something. It's okay to kind of take a step back for a little bit. Just know that the more time you kind of take for yourself to actively recover, the faster you're going to get back to everything, and the better you're going to actually recover. And there's also going to be much higher chance that it won't happen again in the future as frequently. I very much want to work on people kind of breaking the cycle of re-injury, of going back too early to doing something and just getting injured again. It ends up being a very long time that you might be kind of not back to your full abilities. In that case, it's better to take a little time, step back, and then get back into it and not have to kind of go off on shit again or have another injury. It's not a fun cycle to get into, so it just takes a little bit of that proper rest, active recovery, active rehab to break that cycle. So 3 big takeaway points that I want to just mention to everybody is essentially when it comes to our lower limb injuries, there's several things that we can do to very much so reduce the time that we're off an injury, that we can improve our essentially kind of how well you heal and how we can improve our chances of reducing re-injury in the future. So a very big one is going to be, this goes especially if you do tend to like running or other very high impact activities, is you might have to step back from those for a while. Just focus on some alternatives, something like swimming, rowing in some cases, cycling, that sort of thing. Basically with this one is quite literally, you gotta be able to walk before you can run, in the truest sense that you want to ramp yourselves back up to those high impact activities as gradually and as safely as you can. Second big point here is kind of leading off of that is some movement alternatives might be required. Myself, I injured my knee quite badly a few years ago. I wasn't able to deadlift anymore because of that. I slowly got into doing your Romanian deadlift, so you're more not completely straight leg, but a little bit of a slight bend into your knees, keeping them a little closer to your body, a little bit less strain on the knee than being what was my typical sumo deadlift stance. Just changing around some things for yourself of maybe how you do things. You might have to decrease how much load you're using, say, for a squat. Even if it is more minor injuries and it's hurting you each time that you kind of go through a rep or go through a set, it might be a good idea to kind of deload just a little bit there. This is kind of one time where you may have to restrict your range of motion a little bit, just in the sense of helping you start to recover patterns back. So I've talked before about it's very important with squats to get down to your 90 degrees, get those thighs parallel to the floor. In this case, post-injury, during your active recovery, you might not be able to get down to that 90 degrees, and that's okay. There will still be some benefit to be had from working through kind of partial ranges of motion and tracking your progress in that way of the closer you get back to how you used to squat before, for example. Third big point is, again, these are all kind of slightly similar, but this is make sure that you're easing yourself back into your resistance training. So if this is like with free weights and stuff, as I mentioned earlier, make sure that you're kind of deloading a little bit, how much weight you're using, even if it's things like if you're using bands, that sort of thing. If it was a big thing for you to be like running, there's a lot of impact coming through the legs. One of the most significant things I found that helped me out was just doing simple hip abductions with the leg using a light band, working your way up to a little bit heavier. This is going to help kind of re-strengthen those muscles that were injured and that are preventing you from getting back to your regular activities. So to finish up, make sure, especially when it comes to lower limb injuries, make sure that you are minimizing kind of how much impact you're having on your body, on that area of your body. Make sure too that you may have to just pick some alternatives to what you usually train in your kind of typical routine, and then make sure that you are easing back into resistance training, that you're taking it nice and slow, you're giving yourself time to build that strength back up. Thank you very much for watching today, everybody. Thanks for taking the time. time to listen to me talk for a little bit. If you don't mind, and if you'd like to, at the bottom of this video, you'll find the subscription button. You can hit that. We will be posting videos kind of as we go along here, covering a wide range of topics. So if you enjoyed, feel free to do that and just kind of follow along just as we start to release more content. Thanks a lot, and everybody have a wonderful day.
PSP Kingston, the health and wellness provider for the military community.